Yo, we're live.
Okay, hi Periscopers, Dr. Olivia Joseph here. Today we're going to talk about ginger, proper dosage, whether or not ginger is safe or has side effects, and some indications in using ginger. So first let's talk about dosage. Ginger's tricky because if we're talking about dosage, we're talking about ginger supplementation. So in science and research, ginger is typically dosed anywhere between 200 and 1,000 milligrams. So there's a pretty big variation. Now, what I personally use with my patients is between 200 and 400 milligrams. So I don't put my patients on dosages as high of 1,000 milligrams of ginger, but a lot of science and research points to the fact that ginger is most effective for nausea and also pain and inflammation at doses of 1,000. So I would say proceed with caution. I've seen great effects using 200 to 400 milligrams with my patients, and that's what I'm comfortable giving. Now, if you're eating ginger, if you're cooking with it, if you're juicing it, if you're using ginger powder in food and smoothies, you're not gonna be dosing, right? You're not gonna know how many milligrams of ginger you're getting, because when you take ginger supplements, they're made from ginger extract, which makes them more potent and more clinically effective. So if you eat ginger or you're cooking with ginger, how much ginger is too much? There's no such thing. You can eat ginger or use ginger up to what we call GI tolerance. What does that mean? Ginger's a little spicy, ginger's a little peppery. So if you juice it or if you put it in foods, it might kind of make your stomach burn or make your throat burn. I would cut back on it if that's the case. So you can take ginger up to GI tolerance. If you find that you've taken so much ginger or you've juiced so much that you get a little bit of diarrhea, a little bit of stomach burning, don't worry about it. It's not gonna have any long-term effects. Just don't use as much next time is what I would tell you about that. Now, another question I get is, does ginger affect liver function, jaundice, blood pressure, or kidney function? Not directly. Ginger is not fat soluble, which means it doesn't go through the liver. Ginger's not really water soluble, meaning it goes through the kidney. So for that reason, it's not going to negatively impact your liver, your kidneys, or even your blood pressure, because your kidneys are directly connected with your blood pressure. So you're not going to see any negative effects. The worst thing you're going to see, as I said, is a little bit of throat burning, stomach burning, and if you get too much, maybe diarrhea. If that happens, just take less next time. Nothing bad is gonna come of it. What I do wanna point out as far as taking ginger is if you get that mouth irritation, that heartburn, that diarrhea, doesn't mean you can't safely take ginger. Just use less, just eat less, okay? And that doesn't usually happen when you take ginger in a supplement. That usually only happens if you're juicing ginger or eating raw ginger root. So I do recommend about 200 to 400 milligrams for my patients personally. I use ginger for things like stomach upset, nausea, but I primarily use ginger for inflammation. So the one thing you want to be careful of is anything you use to reduce inflammation, whether it's ginger or its cousin turmeric, or high doses of fish oil. Those things naturally reduce inflammation. And if you're taking blood thinners like warfarin or Coumadin, anything that reduces inflammation can also thin your blood a little bit. So what you want to do is if you're on these medications, you want to have your doctor regularly running blood work on you to make sure that your blood isn't getting too thin. Or if you're on blood thinners and you see effects like bruising, bleeding easily, make sure you talk to your doctor and have your blood levels run, because it could be a matter of you're over-medicated. So that's my tips on ginger, and look forward to teaching you more about ginger over the next coming week. Thanks.